imagine this. You're dealing with like this nagging leg pain, maybe even some numbness. You go see your doctor, but it's brushed off as something minor, and then years later, it's too late. You're facing amputation.
Oh, wow.
This isn't some, nightmare scenario. This is happening to thousands because of a condition called peripheral artery disease, or PAD.
Right.
We've got this in-depth UK report exposing the shocking truth about PAD and these preventable amputations.
Yes.
We're going to break down the symptoms, the misdiagnoses, and most importantly, what you need to know to protect yourself.
Yeah, it's a hidden epidemic, really. This report reveals that a staggering number of amputations are happening that could have been avoided. We're not talking about accidents or injuries here, but a treatable condition.
Okay, so let's start with the basics. What exactly is PAD and why should we be concerned?
So think of your arteries like a network of pipes delivering vital blood throughout your body.
Okay.
In PAD, those pipes, specifically in your limbs, start to narrow or get clogged, like a kink in a garden hose. This restricted blood flow, especially to your feet and hands, can lead to pain, numbness, and even ulcers that don't heal properly.
Wow, that's a powerful image. So it's not just about pain, it's about your body not getting the oxygen and nutrients it needs.
Exactly. And the scary part is, if left untreated, PAD can lead to those avoidable amputations we talked about.
Right.
The report highlights that in England and Wales alone, there are 3,000 amputations each year, with the vast majority directly linked to PAD.
3,000 amputations, that's a huge number, but the report claims 80% of these are preventable. What's going wrong here?
That's the real tragedy of this situation. It seems we're failing on two fronts.
Okay.
Patients often don't recognize the early warning signs, and healthcare providers aren't consistently catching it either. The report's leader, Professor Saratsi's, a top vascular disease expert, points out that the average PAD patient sees their GP a shocking 19 times before getting referred to a specialist.
Wow.
By then, the damage can be irreversible.
19 times? That's astounding. You'd think someone would have caught it by then.
You think so? Right, this speaks to a significant awareness gap, both among the general public and within the medical community. To put a human face on this, the report shares some incredibly powerful patient stories.
Yes. The stories were what really stuck with me. It's one thing to talk about statistics, but hearing about real people going through this is truly heartbreaking.
Absolutely. One story that resonated with me was about Brian Hoggard, an 80-year-old man who endured years of excruciating foot pain.
Oh, wow.
He was initially diagnosed with arthritis, which isn't uncommon.
Right.
However, it wasn't until he saw a podiatrist that they discovered the true culprit neuropathy, or nerve damage in his feet.
Ah, so the neuropathy was a red flag for PAD. It's like a domino effect, right? One problem leads to another.
Precisely, and sadly for Mr. Hoggard, the delays in diagnosis led to complications during a procedure to open up his blocked arteries.
Oh, no.
He even suffered a heart attack during the surgery.
Oh, my God.
Ultimately, he ended up having his leg amputated. It's devastating to think it could have been prevented.
It really makes you wonder how many people are suffering needlessly because those early signs are being missed. The report also talks about Alan Gaynor, right? Another case where the warning signs were ignored.
Yes. His story is particularly striking because he was a retired surgeon.
Really?
Even with his medical background, he dismissed his leg pain as just sluggishness from a previous heart attack. He even ignored ulcers developing on his heel.
Wow.
By the time they found an aneurysm, a dangerous bulge in a blood vessel, it was too late to save his leg.
It's a sobering reminder that this can affect anyone, even medical professionals. It highlights just how crucial awareness is.
Absolutely.
So if this is happening to so many people, who exactly is at risk? Is this something we should all be worried about?
Well, age is a factor. This report states that 1 in 5 people over 60 in the UK have some form of PBD, but certain conditions significantly increase your risk.
Okay, so age is a part of it. What else?
Think about those things we often hear are bad for our health. Diabetes, high blood pressure, obesity. Those are major risk factors. And if you smoke, your chances skyrocket. It's like pouring gasoline on a fire when it comes to your vascular health.
So it's not just about age. It's about lifestyle and pre-existing conditions. It feels like a lot of people could be walking around with this ticking time bomb and not even know it.
That's the real danger here. The good news is that early intervention can make a world of difference. The report emphasizes that if we can catch PAD in its early stages, we can often prevent those worst-case scenarios.
So what can people do to protect themselves? What are the red flags they should be looking out for?
First and foremost, be aware of your body. And any changes, pay attention to pain in your legs, especially when walking. If you notice cramping, aching, or a feeling of fatigue that goes away with rest, That's a classic sign of PAD.
So it's not just any leg pain, it's specifically pain that comes on with exertion. What else should we be looking out for?
Be mindful of any numbness or tingling in your feet or toes. It might feel like your foot's fallen asleep, but if it's persistent or comes back frequently, that's a concern. Another red flag is slow healing sores or ulcers, especially on your feet because blood flow is compromised. Those wounds don't get the oxygen and nutrients they need to heal properly.
That makes sense. And then there's the agonizing pain Mr. Hoggart experienced, right?
Yes, constant pain, particularly at night, is another major warning sign. Imagine a pain so intense it keeps you from sleeping. That's the reality for many people with PAD.
So if someone is experiencing any of these symptoms, what's the next step?
Talk to your doctor immediately. Don't brush it off or try to self-diagnose. Early detection is key, and a simple checkup could make all the difference.
But as we've seen in these patient stories, sometimes doctors miss the signs too. What can patients do to advocate for themselves in those situations?
That's a great point. It's essential to be proactive and vocal if you're experiencing these symptoms. Don't be afraid to push for further investigation. Ask your doctor about PAD specifically and request the necessary tests to rule it out.
Okay, so being informed and speaking up is crucial. What about on the healthcare provider side? The report mentions that GPs often miss the signs. What can be done to improve early diagnosis in those settings?
That's a critical piece of the puzzle. The report strongly advocates for better training for GPs and other frontline medical professionals. They need to be equipped with the knowledge and tools to recognize PAD early on.
So it's about empowering doctors with more specialized training on PAD, but it's also about empowering patients to recognize the symptoms and advocate for themselves, right?
Exactly. We need a two-pronged approach to tackle this issue effectively. And let's not forget about access to treatment. The report highlights that even when PAD is diagnosed, there can be barriers to getting the care you need.
Yes. It mentioned a procedure called revascularization. Can you explain what that is and why access is a problem?
Revascularization is like giving those blocked arteries a plumbing bypass. It's a procedure to reopen or bypass the clogged sections, allowing blood to flow freely. Again, think of it as restoring the irrigation system to your limbs.
So it's a pretty major intervention.
It can be,
Right.
and it's often very effective in treating advanced PAD. However, the report reveals major issues with long waiting lists and limited access to these procedures in many areas.
It's like a double whammy. First, the condition gets missed, and then even when it's caught, there are obstacles to getting the necessary treatment. What can be done to address this?
Well, it requires a multifaceted approach. We need increased funding and resources for vascular health services.
So it's about prioritizing vascular health as a public health issue, making sure it gets the attention and resources it deserves.
Exactly. And let's not forget the role of research. We need ongoing research to develop new and innovative treatments for PAD and better understand the disease itself.
So it's about pushing the boundaries of medical innovation, finding better ways to treat and manage this condition.
Absolutely. And let's not overlook the power of public awareness campaigns. We need to get this information out there. Educate people about PAD, its symptoms, and the risk factors.
So a combination of education, training, access to treatment, and continued research, it sounds like a major undertaking. But this report makes it clear we can't afford to ignore this issue any longer.
I agree the stakes are simply too high. Thousands of people are losing limbs unnecessarily. We have the knowledge and the tools to make a difference. It's time to take action.
It's not just about saving limbs, it's about saving lives and improving quality of life for countless individuals. This has been an incredibly eye-opening conversation. I'm walking away with a whole new perspective on PAD and the urgent need for change.
Me too, and I hope our listener feels empowered to do the same.
It really feels like we've uncovered a hidden health crisis here. I think what struck me most is how easily PD can be mistaken for other conditions, and how those delays in diagnosis can have such devastating consequences.
Yeah, it's a wake-up call for all of us.
It is a wake-up call for all of us.
Yeah.
And not being afraid to ask questions or push for more information.
Right.
It's our health, after all.
Exactly. Don't underestimate the power of being an informed and proactive patient.
So as we wrap up this deep dive, what's the most important message you want our listener to take away?
Knowledge is power. We've explored the ins and outs of PAD, the risk factors, the symptoms, and the importance of early intervention. Now it's about applying that knowledge to your own life and the lives of those you care about.
It's about taking ownership of our vascular health, right? Not just waiting for something to go wrong, but being proactive and informed.
Precisely. This isn't about living in fear. It's about empowerment. Armed with the right information, you can make informed decisions and advocate for your health.
So if you're experiencing any unexplained leg pain, numbness, slow healing wounds, or if any of those risk factors sound familiar, diabetes, high blood pressure, smoking, don't hesitate to talk to your doctor.
Early detection is key. It could be the difference between a healthy future and a life-altering surgery.
We've focused on the UK, but this is a global issue. What can be done to raise awareness and improve early diagnosis in your community? Maybe it's sharing this information with a friend or family member, or even advocating for better resources in your local healthcare system.
Every action, big or small, can make a difference. Let's break the silence surrounding PAD and work together to prevent these avoidable amputations.
This has been a truly insightful deep dive, and I hope our listener is walking away feeling informed, empowered, and ready to take action. Thanks for joining us.